Hello and welcome to our latest Pediatric MS Navigating Your Journey program. My name is Krista Harding, and I'm a senior manager on the community engagement team at the National MS Society. As we get started today, we want to remind you that the Society's vision is a world free of MS, and our mission is to cure MS while empowering people affected by MS to live their best lives. We also want everyone to feel comfortable coming to the National MS Society for support. For that reason, we share our inclusion, diversity, equity, and accessibility statement at the top of our program. We amplify the voices of all people affected by MS and celebrate our differences in the drive to end MS. We affirm the space for everyone to express their perspectives, fueling our vision with innovative ideas and insights. We commit to advancing inclusion, diversity, equity, and accessibility within our workforce and across the MS movement. Now, if you've joined us for any of our Pediatric MS Navigating Your Journey programs or listened to one of the recordings before, you have seen this slide, and this is the time at which I would typically give you an overview of pediatric MS. However, today's presenter is going to do a much deeper dive into many of these same topics. So today we're going to bypass this section altogether so I can introduce you to today's speaker. Molly Moehlman is a pediatric neuroimmunologist currently practicing at Cincinnati Children's Hospital Medical Center. She completed her medical school training at UT Southwestern Medical School in Dallas, Texas, her pediatric neurology residency training at Children's National Hospital in Washington, D.C., and then her neuroimmunology fellowship at the University of Colorado in Aurora, Colorado. Welcome, Dr. Moehlman.
Thank you so much for listening to this. It's nice to get to talk with you today. I love working with pediatric patients of all ages, whether young children, teenagers, and even our young adult population. My clinical approach is to partner with patients and families to use my experience and scientific evidence to find the best treatment plan for my patients. I chose neuroimmunology because I loved how personalized treatments need to be for each patient. Two different patients can have the same disease, but it can affect them so differently. And it's so important to get to really know your patient to provide them the best treatment possible. I was thrilled by how fast the field of neuroimmunology is growing. We have learned so much in the past 10 years, expanding treatment options and providing more hope for so many patients. It is my desire that during my time in practice, we will continue to have increased knowledge and additional treatments for our patients. I'm thankful to the National MS Society for providing support during my neuroimmunology fellowship. Wonderful support and information for my patients navigating their journey with MS, and for the opportunity to talk with you today. So let's get started. This topic is really near and dear to my heart because whenever someone gets diagnosed with MS, inevitably we get the question of, why is this happening to me? And what's going on? So today's talk is titled The Why Behind MS, What We Know About the Genetic and Environmental Ties to Pediatric Multiple Sclerosis. So, like we said, why did MS happen to me? And the way to think about it when you're thinking in this kind of fog and this cloud that's going on is that it's not one reason that we know of that MS happens, but it's these multitude of factors, whether it's previous infections, genetics, geographical location, other environmental factors, and autoimmune susceptibility. Those come together to form this perfect storm. And when that lightning strikes, when all of these hit in the right ratios and in the right setting, that's when MS happens. So, the first message that I want to make sure we talk about today and that we really emphasize is that MS is not your fault. And importantly, MS is not anyone's fault. There are many things that we know have to come together to make MS happen. And while it can be very frustrating in the moment, and a lot of times I get patients asking, was there something I did or something I could have done differently to stop this from happening, the best answer we can give is at this point, there is no reason that you did that caused this to happen. And we just have to move forward now that we've gotten to the diagnosis to give you the best care we can. So, what is MS? MS stands for multiple sclerosis, but that's a lot to say, so we'll call it MS for the rest of this talk. It is a neuroimmunologic disease. And what does that mean? So, when we break that down into the words that form that up, the neuro portion means affecting the brain and spinal cord. Immunologic means that it's triggered by the immune system. Your immune system is the system in your body that's designed to fight infections, but sometimes that can get confused. And when that gets confused, instead of attacking an infection that's invading your body, it can start attacking your own cells. And in particular, in the case of MS, it's attacking the cells that make up the brain and spinal cord. Now, what do these cells look like and what are they made of and what is our body attacking? So, neurons are the cells that make up the brain and spinal cord, and they have a big end and then a really long telephone wire tail that goes down to communicate to the rest of the body. That telephone wire tail or axon is covered by a protein called myelin. Myelin is like the insulation of a telephone wire. And that allows nerves to send signals quickly so that when you get the signal to wiggle your toes, it doesn't take multiple minutes for the signal to come down and tell you to do it. You should be able to do it immediately. And so that insulation or that myelination is really important for signals to travel to your body quickly. When MS starts attacking that insulation or that myelin, those signals can become interrupted. And that's when different symptoms of MS can occur. MS affects people across the world. We're learning more and more as we get better at making diagnoses about how many people it actually affects. There have been ongoing studies and surveys across the globe to figure out how many people are actually dealing with and fighting MS. The current estimation is about 2.9 million people across the world are living with MS. This graphic is a really nice distribution in that it shows in the dark red areas that the places that have higher numbers of people affected. But those numbers are changing all the time as we learn more and more. In addition to looking at how many people worldwide have MS, we also wanted to get a better sense of how many children have MS. For a long time, people thought MS was a diagnosis of adults and that pediatrics populations couldn't be affected. We know now that that's really not the case. There are patients under the age of 18, and especially early adults as well, that have the diagnosis of MS, and recognizing that is critical to getting patients started on treatment as early as possible. So what you can see from this is we're still in those same really dark red areas. Those are the bright red areas on this map that you're still seeing that where higher rates of diagnosis are happening. Around 30,000 children across the globe are diagnosed with MS, but there are a lot of places that you can see that are still in the gray that we don't know how many children have MS. And so this is still a huge area that needs to be explored and needs to continue to be reached out for to continue to provide patients with the best care possible. Now let's talk about a little bit closer to home. Across the US, there have been a lot of studies to try to see exactly how many patients have MS. And the National MS Society helped put out a study back in 2019 that showed that about 1 million people in the US are currently fighting and struggling with the diagnosis of MS. That was more than double the expected people that we expected to find. And so as we're getting better at making diagnoses and as we're getting better at recognizing this multiple sclerosis early, we can see that those numbers are really high and we need to continue to provide support and help really challenge what's going on with this diagnosis and give the best care possible. The other reason I really highlight these numbers is to emphasize that you're not alone dealing with this. One of the hardest parts of any diagnosis, but I feel like especially MS and some of our rarer conditions, is that feeling that you're isolated. And so, whether that's through your neuroimmunology provider or through the National MS Society and the other resources that are available, it's so important to know that you have many people across the country and across the world that are struggling with this with you and that want to be there to provide support for you. Okay, let's get into these different factors that we know about influence MS. Let's talk a little bit about genetics. So, the way I like to think about genetics is the cookbook that makes up you. So, if you think about a favorite recipe, one of my favorites is brownies. Chromosomes, which are one of the big things, are your different sections of the cookbook. So whether that's salads, entrees, or in our specific example, it would be desserts. Then within those chromosomes, you narrow down further. Within the desserts, we have your individual genes. And so for our case, genes are like the recipes. And in our example, we're looking at the brownies in particular. Genes then spell out how you should make a specific protein. And the protein in our example would be the brownie itself. So the chromosome takes us to the right section, the gene takes us to the right recipe, and then we can make the brownie itself, and that's the protein that's supposed to be formed. If you mess up any of the steps along the way, whether you put a recipe in the wrong section, or if there's spelling errors within the recipe that say to add 4 eggs instead of 2, you're not going to get the expected product or the expected protein that you're looking for. So, when we talk about the genetics of MS, this gets really complicated. People have looked to see, are there spelling changes in those genes that very clearly cause MS? And what we've found so far is that there are over 230, so 233 genetic variants associated with MS. What does that mean? That means there are lots of different spelling errors that have been associated, but no one clear spelling error that always causes MS. The spelling errors that have been found all are in these different immune cells, or the cells that are supposed to help make up the immune system that fights these infections that we know is the place that's getting confused in MS. Of the different spelling errors that have been found, there's one spelling error that has a bit more of an association. So this particular spelling error, HLA-DRB1 15 on chromosome 6, has the strongest association. So people who have this genetic mutation are about 3 times more likely to develop MS and compared to the general population. But that still doesn't fully explain why MS happens. When we get into this a little bit more, our genes are related to the genes that our family has. And so looking at family patterns of diseases can help us see how strong do we feel like the genetic cause of a disease is. When we look at family genetics of MS, it's important to know a few numbers. So your risk in the general population is about 1 in 330, or 0.3%. What that means is about 1 in between every 300 to 400 people is going to be diagnosed with MS. Now, if my identical twin has MS, my risk of getting MS is going to go up significantly. So in people who have an identical twin, there were studies done to say if one twin has MS, what's the risk of another twin getting MS? And that risk increases to about 1 in every 3 to 4. So that increases to 25 to 30%. Now, the important thing to know here is that identical twins share genes. So their genes and their spellings of their cookbook are the same. And so the fact that only 25 to 30% both develop MS means that genes alone don't explain why MS happens. Because if the spellings are the same and one gets MS and one doesn't, that doesn't make sense. Other things have to come into play. Now, also important in lots of questions that we get asked is what happens if my mom and dad has MS, or what happens if my sibling has MS? We know that those also increase risk compared to the general population. So instead of the 0.3%, your risk increases to about 1.5% if your parent has MS and 2 to 3% if your sibling has MS. So those numbers are still low overall. Again, for 1.5%, that's about 1 to 2 in every 100 people, or the 2 to 3 in 100 people if your sibling has MS. So still rare, but a little bit more likely than if no one in your family has MS. Now, one of the other features that we know of with MS and many other autoimmune conditions is that it tends to be more likely to happen in women. Does not mean can't happen in men, but about 3 women get diagnosed for every 1 man that gets diagnosed with MS. There have been lots of thoughts as to why this occurs. Some of that is likely due to hormonal differences. Um, but there have been more and more studies coming out looking at why do all of these immune conditions, or many of these immune conditions, occur more commonly in women. There have been some interesting studies recently showing that the way our X chromosomes work, for women that have 2X chromosomes, one tends to get inactivated, and that inactivated chromosome may be increasing risk of um, an immune response or immunogenicity that may increase your risk of developing an autoimmune disease. Now, for a long time, it's been well recognized that there's a latitude effect to MS. And so, what do I mean by that? That means depending on where you live in the world and how far away from the equator, that's your latitude. We know that the farther away you are, the risk of MS is higher. So we also know that higher latitudes, or again farther from the equator, are associated with an earlier onset of MS. So by about 2 years, that happens. And there have been studies looking at pediatric populations that show if you move before the age of 15, you take on the risk level of your new home. So people that have moved from more southern locations to more northern locations increase their risk, and vice versa. And I'm going to get a little bit more into the latitude in a few minutes. Other environmental risk factors that have been studied in MS, one of the more common ones that is looked at is vitamin D. Now, there was a couple really interesting studies that came out looking in vitamin D populations, and in particularly in these studies, nurses were looked at with their vitamin D levels and looked at kind of your overall risk of developing MS. What we know is that people who have higher levels of vitamin D had an overall lower risk of developing MS, and people who were taking a supplement had a little bit of a lower risk of developing MS. Once you get to the diagnosis of MS, your vitamin D levels have not been consistently shown to have an effect as far as long-term outcomes. Now, most providers that I know and have talked to still recommend that if your vitamin D is low and you have MS, that we should supplement it, because vitamin D helps with a lot of things. It can help with energy, it can help with overall how you're feeling, and if there's a small benefit, we want to try and optimize that benefit as much as possible. But there have been studies that show that vitamin D alone is not enough to treat MS. So while this can be helpful, we still recommend talking with your doctor about all the treatments that you should be on for management. Too much vitamin D, so taking lots and lots of vitamin D and getting too high, can actually have risks associated with it as well. It can cause problems with your kidneys. It can cause problems with your bone health. And so trying to make sure that we're staying in a good level, but not too far on either end or either extreme, is important. Where do we get vitamin D? Vitamin D comes from a lot of our food sources. It also comes from sunlight. So trying to get outside and in the sunshine can be helpful with vitamin D levels. And then through vitamin supplements if needed, if your vitamin D is low. Now, other things that we've been looking at and trying to study more is the role of infections in development of autoimmune conditions and in particular MS. Now, why is this important? Again, the reason we know MS happens is because your immune system gets confused and starts attacking your own cells. The question has been for a long time, are there different infections that get your immune system revved up beforehand that then trick your body into start attacking your own cells? There was a recent study that came out last year looking at kind of the history and development of MS and in particular that HLA gene mutation that we talked about. What we saw and what they saw in their study when they looked at fossils and genetics and all of these really cool things from across different European populations is that when populations were shifting from more of a hunter-gatherer to more of farmers in the Bronze Age, that's really when you see this HLA gene start to pop up. And so that's what this figure on the left side is showing, is how often your HLA, how often the HLA change that we associate with increased risk of MS is coming up, where it's found. So you can see that's much more likely in the Northern European population compared to our African population at that point. And you see that when they look through the different fossils throughout different time points, you don't see HLA subtypes start popping up until more the Bronze Age. And so this shift of patterns is thought to kind of have been what triggered our immune system. And they actually looked and compared in these old fossils and in this old history, are there different infections that go along with triggering MS versus rheumatoid arthritis, a different neuroimmunologic disease? And while the data is not definitive, it shows that there are probably different infection patterns in different places that predisposed your immune system to act differently and to make different autoimmune conditions more likely. That kind of takes us into infections of the present. So while learning about why MS developed overall, we also want to know what triggers, are there any infections today that potentially trigger our immune system to become overactive and to cause MS? One of the one of the infections that have been studied is EBV or Epstein-Barr virus. Now, there have been many different viruses that have been looked at for MS, and none have been definitively linked, but EBV has the highest association so far. So a recent study in 2024 shows that your risk of MS increases 32-fold after an EBV exposure. So that's a lot. That's a pretty big risk. Now, the challenge with this is that EBV is really prevalent. So what do I mean by that? Lots of people have been exposed to EBV. When you do studies of the general population to see who has antibodies or signs of prior EBV infection, by the age of 5, about 50% of the population has already been exposed to EBV. And by the age of 18, it's about 90%. And we know that not 90% of the population goes on to develop MS. So while this link is there and definitely shows a strong risk of development of MS, again, just like the genes, it's unlikely and does not seem to be enough. Thinking back to our storm analogy right at the beginning, again, it's probably more that these multiple factors come together to cause MS. And so EBV is concerning and likely to be one of the factors, or thought to be potentially one of the factors contributing to develop of MS, but not enough to cause everyone to have it. Now, how does this work? What's thought is that EBV, when it's invading the body, can go into the cells and into the immune cells and cause production of a protein that mimics myelin. Again, myelin is that protein that covers the nerves that we need. And so, because it's making this what we call protein mimicry or pretending to be that similar protein that your body makes, that's what causes then your immune system to say, oh no, we need to attack this. And so, even if it's not the mimic, but actually your cell itself, it continues to be confused, and your immune system thinks it's fighting an ongoing infection, even though it's already taken care of the infection. Now, why do I bring this up and what's optimistic about this? There's a lot of research going on into whether there could be a target vaccine potentially for EBV down the road that, if given early, could potentially decrease risk of MS development. Doesn't change where we are today, but potentially for the future, it's an optimistic thing that could hopefully help give further protection. Now, there are multiple other factors that go into both MS severity, um, as well as potentially increasing risk. One of the factors that we know about is obesity. So we know obesity overall is associated with increased risk of development of MS. Why we know obesity is a problem is obesity in general increases inflammation. And in addition to increasing the risk of development of MS, we know that our patients with MS that struggle with obesity have increased risks of relapses and disease progression. And so continuing to try and optimize weight, optimize nutrition, and increasing and maintaining exercise as much as we can, even through the struggles of MS, can be really helpful in keeping that inflammation at bay and trying to help minimize relapses and progression. There have been a lot of questions in some studies as to different diets with MS. Diets overall, there are a couple of diets out there that people talk about for MS. The literature surrounding these diets is relatively limited. Some of the studies that we have don't show necessarily one clear diet that is beneficial for MS, but in general, trying to optimize eating healthy and getting exercise overall has shown to decrease inflammation and help protect against relapses and disease progression. Let's talk about smoking. Smoking is another factor that we know has a huge risk in MS, and not just personal smoking, but secondhand smoke exposure can increase the risk of development of MS, and it makes it about 2 times more likely from the research that we have. In addition, while we know that it increases the risk, just like obesity, continued exposure to secondhand smoke or personal smoking increases your risk of relapses and increases risk of development of progression. There have been studies that show that you have an increased risk of developing both primary progressive MS and secondary progressive MS with ongoing smoking. And what we also have seen is that people who quit smoking have a delay in that risk of progression by multiple years compared to people that continue to have cigarette exposure. So, as best as possible, working to try and minimize your exposure to this can continue to help protect your health. And it's something that if this is something you struggle with, because we know that it is very hard to quit smoking, talking to your physician and working with your physician on developing a strategy to try and minimize this can be really helpful for your health and for management of your MS long term. There have been a lot of other things that we've been looking at to see are these having an effect on MS. Chronic stress is, I think, a huge one in general that people are really interested with how this affects inflammation. We know that chronic stress can change your overall cortisol production and that cortisol is a hormone that your body releases in times of stress, can affect inflammation. So we know that in general, chronic stress can increase just your overall general inflammatory picture, but there have been no specific studies in MS patients so far that have definitively linked chronic stress to either relapses or initial development of MS. There's been a lot of questions regarding heavy metal or other toxic exposures. The research in this is still ongoing at this time, with some mixed literature out there as far as outcomes. Gut microbiome, so the bacteria that make up our GI system and live within us, and its relationship to inflammatory diseases, is overall a very interesting topic of communication within the medical field that's being looked at in multiple different areas of inflammatory disorders. Again, at this time, there's no specific studies that show it directly causes MS, and no specific studies to show that changing your gut microbiome has a big impact on MS treatment, but we still have a lot to learn about this, so continuing to expand areas of research. Vaccine use. So again, we talked about looking at EBV as a potential vaccination as a potential treatment or decreasing risk of MS. There have been no specific vaccines that have been clearly shown to lead to the development of MS. And typically, most providers continue to recommend vaccine use to continue to protect against other infections. Though, depending on what MS treatment you're on, talk to your provider to make sure all of these vaccines are appropriate for you. Environmental allergens, and organic chemical solvents, again, are other ones that we continue to look at. Now, I'm going to switch gears for just a second away from MS and talk about a few of MS's cousins. So, these are other really exciting areas in the field of neuroimmunology that we're learning more and more about. So, MS has been recognized as a disease for a very long time, but how MS presents can look really different. And what we're learning is that there may be some different autoimmune conditions that mimic MS but don't perfectly fit how we would describe as classic MS. Two of those conditions have become more defined in the literature in the last 20 years. One is NMOSD, or neuromyelitis optica spectrum disorder, and the other is MOGAD, or myelin oligodendrocyte glycoprotein antibody disorder. Again, those are really big words, so I'm going to call them NMO and MOG for right now because that makes it a little bit easier. How these differ from MS is that you can have different presentations of symptoms, some of which mimic MS, some of which are a little bit different. You can have changes on your MRI similar to MS, but these can look a little bit different as well. And then we do antibody tests to see is your body mounting responses to antibodies against the specific ones related with NMO or MOG. And in the right clinical situation, so in the right setting that you and your provider are working with of the symptoms you are having and what your MRI looks like, if one of these antibodies come back positive, a different diagnosis rather than MS may be more appropriate for you. But that's why continuing to work with your providers is so important. These are both newer diagnoses. So NMO is something we've been testing for within the last 20 years, and MOG's even newer than that, with testing coming about being more available starting around 2015. So because these are newer, we don't have as much literature and as much knowledge about these disorders as we do with MS. But we're learning lots and lots about them all the time, and these are areas that we need to continue to study to see how these are similar to MS and how these might be different, because that impacts how we should be treating them. One area that is recognized is that NMO in particular has a higher predominance in African and Southeast Asian populations rather than MS. And so making sure we're not making a misdiagnosis is important because overall, how people do with these diseases and what treatments we should be using are different depending on whether it's an MS, NMO, or MOG. So that was a brief whirlwind overview of what all goes into developing MS. Hopefully from this you've gotten that MS is really a complicated diagnosis and it doesn't have one simple etiology. Because of that, because it's multiple things coming together, there's nothing that you did and there's nothing that your parents did and there's nothing that anyone did that caused you to get MS. We know that genetics play a role but are not enough by themselves. It's thought to be genetics and environmental factors that come together to form that perfect storm that leads to the MS diagnosis. When enough risk factors come together, that's when your immune system stops functioning how it's supposed to, starts attacking your own cells, and that can lead to MS. Lots of work for a long time going into learning more about all of this and what causes MS. And so I have the benefit of leaning on this wealth of knowledge from lots of different people who have spent their lives and their years studying MS. So I'm thankful for all the research that's come to fore before and excited to see where we can go from here.
Well, thank you so much, Dr. Moehlman. I loved that presentation. As an avid cook, the cookbook and recipe reference really hit home for me. And I learned a lot of really exciting and new information. So thank you again for your time and for sharing your area of expertise with us.
Thank you so much. It was really nice to get to talk, although virtual, with all of you today. And if questions come up, please reach out and I'm happy to answer as best I can.
Thank you. Before we wrap up today, I do want to share with you some great resources for the pediatric MS community. So far today, we've learned about MS and a lot of ways you can feel your best. We want to remind you that the Society is here for you through each new change you go through with your MS. The best way to find all these resources is to visit our website at www.nationalmssociety.org/pediatric-MS. There, you'll find our Pediatric MS Resource Guide, which has a comprehensive list of helpful resources for families affected by pediatric MS. You'll also find information about additional organizations that support youth and teens with MS and their families, as well as financial resources for families impacted by pediatric MS. While you're on our site, you can check out the Find Doctors and Resources tool, which helps you identify providers that are close to you. And we also encourage you to check out our other opportunities to engage with the Society and connect with others through our advocacy efforts, volunteer opportunities, Walk MS, and more. And if there's ever a time when you have questions or need additional support, you can contact an MS Navigator. MS Navigators are skilled, kind professionals that can help you work through challenges and changes with MS based on your personal experience. Some resources that MS Navigators provide include emotional support resources, access and referrals to MS healthcare specialists, support working through health insurance options, benefits and employment resources, wellness strategies that can make an impact on quality of life with MS, and much more. They can help you figure out what you need and how to talk to the right people to get it. You can talk to an MS Navigator over email, by direct message on our website, or you can call 1-800-344-4867 to learn more. They can help both parents and kids and give you helpful resources for your whole family. If you are a young person who wants to talk to an MS Navigator, please make sure to check in with your parent or guardian first. If you're interested in connecting with others who can relate to what you're going through, I would encourage you to join one of our groups available to only those affected by pediatric MS. High school-aged and college-aged young people with MS can join our MS Youngsters group, which meets virtually on a monthly basis and is led by a society-trained volunteer. You can also follow them on Instagram at MS Youngsters. Parents are also invited to join our group just for parents of a child currently 25 or under who has an MS diagnosis. Again, this group meets virtually on a monthly basis. You can find out more about both of these groups on our website. Thank you again for attending our program, and we hope to see you again soon.